how we knew my dad had it. Like, I don't know how my mom slept beside him. And she's like, you know what? I'm not sleeping beside him because I'm so worried that he's not breathing.
Yeah, it's the not breathing part that's
always
very
talk to the
scary.
person sleeping beside you.
Yeah. Okay.
Yeah.
Good to know.
Yeah.
Let's talk about insomnia. A lot of folks dealing with that.
Insomnia is a leading sleep disorder, and you can suffer from one or two ways. So one is acute. I've had it, you've likely had it, everyone in the audience has probably had it. It's just a night or two of not sleeping well.
Right.
Maybe you're not feeling well. You know, we women go through hormonal shifts.
Yes.
If you're suffering from chronic insomnia, that's long-term sleep loss. So always think 3 and 3. It's 3 nights or more per week or 3 months longer. Then we're talking about chronic. There's different types of therapy. We can look, we talked about sleep hygiene, right? Bedroom, great bedtime routine, all of that stuff.
Yeah.
But with insomnia, you have to take it one step further. And so there is cognitive behavioral therapy for insomnia, so CBTI. And under the umbrella of CBTI, there's different therapies that you can do. One of them is through positive affirmations. Because if you haven't been sleeping well, you have a pretty negative relationship with sleep. Like your thoughts are, I'm the world's worst sleeper, I'm gonna feel awful tomorrow. That doesn't make you sleep well, right? So shifting your mindset, writing out, choose a couple mantras. I love my bed and I love to sleep in it. I'm gonna, you know, I might sleep not great tonight, but I'll feel great tomorrow. Write it in your journal. Use some positive affirmation cards.
These are
whatever
great.
you need to do.
Mine says joy. I follow my bliss and accept limitless joy. Whatever it takes to get your brain in the right space.
Reducing that stress, reducing that anxiety is what works.
When you get on that anxiety train and you're looking at the clock and it's 1 o'clock, I'm not going to get sleep. It's 2 o'clock, I'm not going to get sleep. And then it's like, oh my gosh, it's over. So really good. Get the positive thoughts in. What have we got next in terms of disorders?
So now we have restless leg. Restless leg syndrome is when a person is lying, resting or laying down, they have a crawling sensation in their legs. And they actually have an urge to constantly move. And the only way to alleviate that is to actually get up and move. So we can see this through low iron, magnesium deficiency. It can be hereditary, so it can be passed on. Pregnancy, varicose veins. So a great way to alleviate restless leg, focus on sleep hygiene. Really focus on your sleep health. Talk to your doctor if you need any kind of supplement treatments. And exercise. Exercise can alleviate that restless leg feeling, that crawling sensation.
Do they ever say don't exercise at night though? Like, is there anything to prove that that might get you all hyped up at night?
Yeah, I always say it depends on the individual. Some people can benefit from working out at night, whereas some people, it just amps up their adrenaline, right? So it depends on the individual.
Right, if you're a rock star, don't do it.
That's
if you're going to be partying all night because you did leg day, no, forget that. Thank you so much.
Kansas beats Michigan State 77-69. And Hunter Dickerson leads in talks with 28, and freaking Fiddle led Michigan State with 15. Kentucky beats Duke in a slight upset, 77-72. Duke led 46-37 at the half. And then a foul by Duke. 2 made free throws. Kentucky took over late, 77-72. They hit 2 free throws to go ahead. Now we're going to talk about sleeping in major depressive disorder and include this all into this snoring and how it relates to common sleep disorders. Snoring can be a problem for relationships, and some relationships may cause it to sleep in the other room. It can be heard all over the house. If you're not taking care of the problem and you are not having a sleep machine, you are selfish. It's also something to add to be taken care of on your list. Obstructive sleep is the most common related breathing disorder. People with obstructive sleep apnea start breathing and sleeping. They have several times of sleeping. Obstructive sleep apnea occurs when the throat and muscles and block airways. This happens one of many times during a sleep sign. Obstructive is snoring is a treatment for obstructive sleep apnea. Are available on one treatment is a device that uses positive pressure to keep the airways open during sleep. Another option is a mouthpiece thrust lower jaw forward during a sleep. Surgery might be an option too. Symptoms of sleep apnea include excessive sleepiness daytime, loud snoring, absurd episodes of stopped breathing during sleep, waking during the night, gasping and choking, awaking morning with a day of dry mouth or sore throat, morning headaches, trouble focusing during the day, mood changing such as depression or being easily upset, high blood pressure, decreased interest in sex. When to see a doctor, consult a doctor following snoring, sleep, disturb others, waking up, grasping, pausing, breathing during sleep, having excessive daytime drowsiness. This may cause you to fall asleep whether watching or driving a vehicle. Snoring does not necessarily indicate that some potential serious, and not everyone who snores has obstructive sleep apnea. Be sure to make sure the member of your healthcare team, especially if you're snoring interrupted periods of silence. Snoring may be at least in brief pauses, known as apnea, may be more common when you sleep on your back. Ask your healthcare provider about sleep problems, leaf fatigue, and irritable regular spaces, excessive daytime drowsiness. Obstructive apnea, when muscles throat, back, these muscles of the roof mouth known as soft plat. The muscles support the tongue sidewall of the throat. When music is relaxing, the airwaves narrow, close your breather. This can lower oxygen level. You're awakened with shorten of breath, correct itself within 2 deep breaths. Might make a snoring, choking grass sounds. The pattern keeps it repeat 5 to 30 minutes or more each night, all night long. This disturbance your ability to reach a deep result of phase of sleep. You probably sleep during waking hours. People with obstructive sleeping apnea might not be aware of interrupted sleep. Many this type of sleep apnea realizes haven't slept all night. Sleeping decisions are closely linked in lack of sleep depression. Symptoms of depression include mood difficulty, concentrating, and lack of energy. Treating sleep problems can alternatively symptoms. Depression is marked by presents bonus of sadness, disappointment, or hopelessness, emotional and physical, led to difficulties when difficulty remained present for more than 2 weeks, felt nearly every day. A day may be mood disorders called depressive disorders. Depression are often slept by troubles. People with depression find it difficult to fall asleep and stay asleep. And the opposite. During the night, they sleep too much. Understanding why complex relationships between sleep depression can be important to step improving sleep quality and better managing depression. There's only one time this has happened to me where I laid in bed all day. It was from 2019 to 2018, from 2018 to 2019, or 2019 to 2020. Whenever it stopped, it was around COVID. It expanded to me why it was a very big problem, and I remember how lazy I was and how much I slept. And that did not lead to a healthy life. I think sleeping as least as you can during the day is important. That's Sam Vaughn Sports and Sam's Vaughn Mental Health Day.